Hello everyone, it's Erudite
and 065
from Post Jungle. Induction of Labour. So what is induction of labour? This is the artificial initiation of uterine contraction in a pregnant woman with intact membranes after the age of viability with the aim of achieving vaginal delivery. So what are the indications? The indications for induction of labour may be maternal or fetal. Maternal indications include pregnancy-induced hypertension, preeclampsia, chronic renal disorders, heart disorders. Fetal indication includes post-date pregnancy, post-term, intrauterine fetal death, pre-labor rupture of membrane, congenital anomalies, unexplained antepartum hemorrhage. What are the contraindications to induction of labour? These may be relative or absolute. Absolute indications include cephalopelvic disproportion or contracted pelvis, major placenta previa, transverse lie, previous classical cesarean section, and active genital herpes. Relative indications include breech presentation, multiple gestation, grand multiparity, oligohydramnios, suspected macrosomic babies.
The prerequisites for induction of labor. So the gestational age of the fetus must be calculated adequately to prevent the baby from being born prematurely, also known as iatrogenic prematurity. Valid indications must also be established and informed consent must be taken from the mother. Fetal life, fetal presentation, fetal position, and fetal station must all be determined so as to know if they are normal. The fetal biophysical profile must also be measured so as to know the well-being of the fetus. There must be no contraindications to vaginal delivery. Bishop's core assessment of cervical ripening should also be done. And in case of emergencies or complications, facilities must be readily available for emergency cesarean section and special care baby units. So the methods for induction of labor could be medical or surgical. The medical method includes giving of oxytocics and prostaglandins. Prostaglandin analogs can be given, such as PGE1 misoprostol and PGE2 dinoproston. Then the surgical methods for induction of labor include artificial rupture of membrane using amnio hook or Koch's forceps. Then extra amniotic saline infusion could also be done. The complications of induction of labor include failure of induction, which is the inability to achieve vaginal delivery after induction of labor, fetal distress due to repeated contraction of the uterus, then prematurity, which is when the baby is born too early due to induction of labor, also called iatrogenic prematurity, cord prolapse, tachysystole, in which the uterus is contracting at a rate of greater than 5 contractions in 10 minutes, hypertonus, in which the uterine contractions last for more than 60 seconds, then bleeding, amniotic fluid embolisms, and infections could as well be a complication of induction of labor.
For more interesting videos, don't forget to like this video and subscribe to our channel Post Jungle. Thank you.
And we push it.